Welcome to Behind the Mask, episode 6, where real plastic surgery experts break down real-life cases from the most bizarre to the hottest trends. We're going to take you behind the mask to get unfiltered analysis from our true experts. I'm your co-host, Dr. Bill Adams, and with me is my dynamic duo, my co-host, the world-renowned plastic surgeon, Dr. Jason Pozner from Boca Raton, Florida, as well as our special guest expert and Dallas plastic surgery consultant, Ellery. How you guys doing, team?
Fantastic.
All right, listen, let's get into it. We're going to talk about some interesting stuff today. Our first clip comes from an episode of Botched. This is where a patient truly believes that bigger is better. So let's take a look.
So the first one, do you remember how many cc's of fat they put in each buttock?
1,500.
In each buttock?
Yes.
Wow. The standard practice in the United States is to put no more than about 600 cc's of fat in each buttock cheek, because beyond that, the risk of a complication or a fat embolus breaking off and going to the lungs is extraordinarily high. You've also had breast surgery, right?
Yeah.
And you want them bigger?
Yes. And my nipples are in the middle.
Yeah?
I want them like more down.
Down.
Yeah.
We're not going to do that. But I mean, I could theoretically do an operation where I downsize your implant and lift them together, but you'd have to go smaller, which I don't think you're interested in,
No,
right?
I'm not.
Okay, a lot to talk about here. This guy's like he's like the king of the black pearl. But I mean, Ellery, what do you think?
I'm a Texan, so everything being bigger, I'm a big fan of, but I'm just confused why she needs to make her body bigger and enhance everything. The fact that her breast fat transfer size is already as large as it is, and the lips and the breasts, when do we stop?
We just came back from one of the, plastic surgery meetings of which you became president, right? So where did you ever say that the maximum anyone puts in a butt is 600 cc's? I think it depends on how much fat they have and what their buttocks look like. And if we get our good friend Dr. Del Vecchio on, he's been in my OR putting 2,500 cc's in, which is a bit much for me, but, in the right patient, I can maybe see that being done. So I don't know where he gets his data from. It makes no sense and never been published.
Yeah, it actually is where you put the fat. It's like above the fascia, the subcutaneous plane has been shown to be the safe plane, and people get into trouble. Even they put in 300 cc's of fat, you could potentially have a real big safety problem if you're under the fascia. So that's really the take-home point.
Has it been proven that the more fat you put in, the more risk of embolus you have? I've not seen
No.
that data.
It's because not when you're subcutaneous. And as a matter of fact, the real life data would prove that's not true, because we do know there's people that do it very safely and never had a problem that are subcutaneous. That's what's called safe subcutaneous buttock augmentation. I think there's other things too, but I guess the point of this is just the bigger is better thing, which I think you hear a lot, and I'm not sure that carries weight either.
In today's society, at least, a lot of people think that they want to enhance a lot of things, but I think a little education would go a long way as to why bigger isn't always better, especially because it seems like she's pretty unstoppable at this point with enhancing more than one area, and then we didn't even address, the lips and all that. So it's like,
You seem like a pretty big girl to start with. I mean, I think like when you get past the bigger size on her implants on her, she's just gonna look fat. I don't think it's gonna be
well, I think that's the goal, Dr. Pozner. I think bigger of everything is the end goal here, or at least that's what I'm.
I like where you're going with that, Jason, because one of the things is I think when it comes to whether we're talking about breasts, the buttoc's a little different, because I think there's clearly some patients that like a much bigger out of proportion buttock. That's been, it's this social media trend. Who knows how long it'll last, but certainly in the breast, bigger is oftentimes not better. And like you said, I see so many patients that say like, I went somewhere, I got these big, huge implants, and now they make me look fat. That's what they say. It makes them look fat. They don't want a big breast. They just want nice shape, and that's what's important.
That was my clinic day today. I mean, we saw a bunch of patients that I recommended taking out their implants and doing the lift because they had gone through menopause and they gained size and they wanted to be a little smaller. And they had no problems with any BII stuff. They just were looking fat and they wanted to look skinny.
Yeah.
So we end up doing more of that than anything else these days, on making the shape improved on the patients. And it might be adding fat, taking away tissue. I mean, it's all part of the game.
Let's move on to our next topic. It comes from a famous TikTok star, which could be an oxymoron, but who became very popular for her striking cheek enhancements, Ellery. Ellery, lead us off in this one.
A few things. Well, when I thought you said TikTok star, I thought that you had dance prepared for us. So I guess a TikTok dance, yeah. That's coming at the end. Second thing is, I don't know if that's sunscreen or skincare, but I have to say I admire the regimen. Keep that up.
She's going to be on Men in Black 4.
That's it. They just started filming. That's it.
But I mean, I think for the layperson, so she's had a procedure done where she actually has implants that have been placed on top of the cheekbones here, on both sides.
You think it's implants?
Oh yeah, I think for sure it's implants. I mean, I don't think you could get injections that would even give you that much.
Could injectables do that?
Yeah, you probably can't do it in one session, but you could probably build them up over time if you keep injecting.
How do you handle that if you get somebody that comes to you that says, this is what I want, or say somebody brings you this girl's pictures and I want this? How do you counsel the patient?
Bill, that's a really good, serious question. And the two of us have both been in practice for a number of years, and we learned to say no. But I can see where like the novice surgeon who doesn't know how to say no can say something. I'll be like, that's not happening. I'm not going to do that. I don't want to do that. Maybe there's someone else, but that's not in my wheelhouse. And I gently let them down that it's not anything that I feel comfortable doing. But I mean, that's something that comes with experience. You don't say, get the fuck out. I mean, you don't really say that to these patients. You just say, I'm not really comfortable. I'm not experienced going off that big. You need to leave.
I think the proper way to say no to this without stepping on any toes is to just hype up the fact that, Dr. Adams, Dr. Pozner, they are experts in this field. They're not going to do that. We aim for natural, we aim for enhancing the natural anatomy, so we're not going to do that, and hopefully it resonates with the patient that these guys are the experts and they say no, so I'm not going to do it.
Change the argument around a little bit, the discussion, that we've seen some patients with extreme modification of their bodies. Some of the tattoo people. Yeah. Matter of fact, about 5-6 months ago, I took out, a guy had a star in his forehead. Like a real star, a silicone implant star, and I took it out. So that's something I would make back to normal. I just made a little hairline incision and pulled it out, but I would never have put it in. But it was put in by a body modification tattoo artist, not by a plastic surgeon. So I can see them.
I get that, but I don't think that's what she was going for.
No, she's going for a crazy look.
Yeah, I mean, there's standards of beauty. And so like you can add volume to the cheek, which it enhances people's look and gives them some shape to their face, which is considered to be an element of beauty. But this is like way overdone. So this is not beautiful at all. It's distorted anatomy. But Jason, we're just talking logical things like norms of beauty, aesthetics. And there's some people that obviously have a different view of that. I think they're way in one end of the bell-shaped curve, so it's not a lot of people, but it's who's to say? I mean, I don't.
Yeah, but if one of our core guys did this and there was a complaint lodged, this is an ethics violation. That person would probably be kicked out of the society, perhaps lose their board certification status by having patients look like that. At least they would make some trouble for them with the state medical board.
Yeah, well, I think the issue, one of the issues is you have no idea with that degree of augmentation. Let's say it is an implant, so that's permanent. You don't really know what the effects of that are over time. In 3 or 4 years, is it going to look terrible because it's so out of the norm? We have no idea. If it's a filler, who knows what kind of filler it is? Now, one thing is if it is a filler, some of those are reversible, and you might be able to dissolve it. I just can't believe that's a filler. It's too symmetric, and there's so much projection. I just don't know you would get it. But Yeah, it's a weird case, and I just don't know who thinks that looks good.
Yeah.
All right, let's move on to our third and final case. It's from Us Magazine. 90 Day Fiancé star Angela Diem chose to get weight loss surgery before ever attempting to lose weight or quitting smoking. And Jason, you brought this to our attention. Who knew the surgery was still allowed on smokers, though? I mean, in this day and age, Jason, lead us off on this.
I think there are three things that of this case that really bothered me. One is that just because she's on 90 Day Fiancé, she's a celebrity. So like that kind of, I don't think she's a celebrity. I think she's just like a crazy person on TV. That's one. Number two, she's smoking before her breast reduction. And number three, she's getting weight loss surgery and a breast reduction at the same time. I've always told the patients for years and years, if you're heavy set and getting weight loss surgery, wait till you lose all the weight, and then we'll reassess and we'll do what's necessary. I've never once done one kind of surgery like this on a patient who recently had a weight loss surgery or was getting one at the same time. It made no sense to me. So that's why I forwarded this to you and I said, let's discuss on Behind the Mask.
It's crazy. Ellery, what do you think?
I think any good plastic surgeon, like you two, you want to not only maximize the outcome, but you also want to increase the longevity of those results. And so I think going into it at the proper starting point is key for that. And going into it at the wrong starting point, it just, it opens the door for needing more procedures and leading to unsatisfied patients.
Yeah, I think you both bring up some really great points. I mean, just a couple only things I would add to it is just like both of you are saying, for example, if you don't lose weight, so what happens if you do, say, breast reduction or breast lifts, and then you lose weight, then all of a sudden you have excess skin. And you should have lost weight in the front end because then the skin could have been removed when you did the surgery. But now you have skin, and what are you going to do about that? And you may end up with another surgery. So it's just backwards logic again. And then in terms of the smoking, yeah, I mean, it's just not only is it's not good health, consciousness or practices in itself, but Jason, as you're saying, it's a huge safety problem. If you do a breast reduction on a smoker, we all know what happens. They're going to have oftentimes horrendous healing problems. They could lose their nipple. It's just not
you got two complications in there. You're heavy set, you have wound healing problems too.
And it's not dissimilar to, who's going to encourage their child to go drink and drive? I mean, nobody, right? Because we know what the consequences of that are. So that's why us as legitimate plastic surgeons who know these things really are pretty hardcore about not allowing smokers to have this type of surgery. They can be tested. We basically tell them they need to stop a month before and a month after at a minimum, or they just can't have the surgery.
I've never heard of this kind of combo weight loss surgery and a breast reduction. It makes no sense to me. As Bill said, you're just setting yourself up for after she loses her weight, needing additional surgery, and perhaps even implants for the volume that he removed.
Well, those are some, I think, great advice and great stuff from the team. And thanks for joining us this week on Behind the Mask. You can find us on our YouTube channel or the plasticsurgerychannel.com. For Dr. Jason Pozner and Ellery Milliger, I'm Dr. Bill Adams. Until next time.